Hello, and welcome to week 11 of Thinking Sociologically. This week we are going to talk about the social construction of health and illness. So let's start here, which is where we have been starting very explicitly over the last couple of weeks. Yes, health and illness are socially constructed. Much like gender and race, it's probably the first time that you've heard anybody say that to you. But let me tell you what I mean when I say that. Much like deviance, which is also socially constructed, illness and health are dependent on time, place, and context more generally. Um, what that means is that what health is, or what a healthy person is, and by extension, what illness is, and what an ill person is, changes depending on who the person is that you're talking about, the conditions under which you're talking about them in, and so on and so forth. The culture that they belong to, the religion that they belong to, all of those things impact how we define health and illness in the United States. And if that's the case, then health and illness conceptually cannot be objective, scientific, absolute facts. We have seen what we consider to be disease or illness change over time, and what we perceive to be health and healthy bodies change over time. That's not because the science is changing. That's because the scientists are starting to recognize the extent to which they are socialized into particular cultures and communities to think and believe that illness and health look a particular way. Um, for example, recently there have been a lot of public discussions about maternity treatment for Black women compared to non-Black women. And research has shown that doctors believe that people of color feel pain differently. They're more likely to disbelieve the amount of pain they're reporting and to underprescribe them and undertreat them as a result. And so that's one example of how health and illness are socially constructed, in this case, along with race and gender, which are two other socially constructed concepts that we've talked about over the course of this semester. Okay, if health and illness are socially constructed, then the culture and not biology determine which illnesses are disabilities, which are stigmatized, which are definitive, and which are contestable. So, what does that mean? Um, Things like dyslexia, even 20 years ago when I was starting college, were not seen as legitimate disabilities that needed institutional support and intervention. Instead, they were thought of as sort of individual illnesses that each person sort of had to learn to deal with on their own through therapy or medication. Now, in 2020, we think of dyslexia and ADHD, ADD to be disabilities as opposed to illnesses. And if they're disabilities and they are definitive disabilities, then they deserve institutional support. And that's where you see, especially over the last 5 years, really a big uptick in schools across K through 12 and post-secondary, trying to provide more institutional supports for students with learning disabilities. Um, when we talk about stigmatization around health and illness, think about the AIDS epidemic. Um, We let that virus run rampant through the United States because we stigmatized it. We deemed it to be a disease that was specifically focused on gay people, gay men specifically, and if you want to get even more specific, gay Black men, a group of people who already have stigmatized identities, and adding this illness on top of it just further stigmatized this group of people because we had decided that this particular disease, AIDS and HIV, were gross, were bad diseases, and were for amoral people only. Had we as a country understood epidemiologically the public health implications of letting that happen, we may not be in a place today where in 2020 Black women make up the highest rate of HIV and AIDS new diagnoses every year. Um, what about definitive and contestable? Well, COVID 19 has been deemed something that is contestable in terms of its verification as an illness. You see anti maskers talking about how it's a hoax. You heard the president talking about how it was a hoax a couple of months ago before he himself was infected. Despite his infection, we still continue to, in public discourse in the United States, act as though the existence or not of this particular virus is there, which seems like a weird thing to say when more than 200,000 people have died. But again, this is a good example of how health and illness are socially constructed. That's very different than cancer, for example. Any kind of cancer, really, at this point in the United States that we think of as very definitive, we take seriously. You only have to say the word cancer for people to get and understand the seriousness of what you're talking about. Those things change and are reshaped over time. Cancer 50 years ago was not something that was in the lexicon of most American citizens. And today, almost everybody has been touched by the disease, and so we think of it as definitive. Okay, so if health and illness are socially constructed, then there must be some social determinants of health. And this little figure is just to show you that each individual in the world, even though we like to talk about groups, this is about the individual and the environmental, economic, social, educational, and healthcare based facets of their healthy or ill life. So let's expand out and talk about what that means. Um, Environment. What is your neighborhood like? Is it walkable? Are there parks? Can you get exercise? Are there gyms? Can you go outside and breathe the air? Inner cities are much more likely to have smog and by extension to have a population of people, especially children, with serious asthma. Um, it's also true that most inner cities are working class communities where many of the people do not have access to insurance or subsequent quality health care. And so now all of a sudden, where you live and what your race and class identity are having big impacts on your health. Are there grocery stores? Is this a food desert? Um, you'd be surprised to know that many places in Philadelphia are food deserts. For 2 years before I moved up to Collegeville, I was living down in Germantown, and I had to do my grocery shopping up here in Collegeville on my way home because there were no grocery stores in my neighborhood, and the closest grocery store did not have quality produce, and the prices were much more expensive than up here in the predominantly white community where I work. Um, and if you were to do a health audit of the people in that neighborhood in Germantown where I lived compared to the people who live up here in Collegeville, you'd see a huge difference in health and quality of life because of something simple like environment and food. What about education? If you don't have a certain level of education, we talked last week about how education perpetuates inequalities, then you may not understand all of the long-term implications of some of the behaviors that you engage in, whether it's eating behaviors or physical activity behaviors or even sort of mental health issues of mental health that you might not otherwise have information about if you don't have a certain level of education. I personally dealt with anxiety as a child, but nobody really understood what was going on because in my family, at the time, in the 80s and 90s, people were not talking about therapy or psychologists or any of that stuff. It wasn't until I went to college, to a college with a lot of social capital and support systems, that I was introduced to the idea of psychological therapy and how it might help me. And I wouldn't have had access to that had I not had the privilege of attending that school, and my life would probably be much different. Okay, let's look at some charts to sort of talk about how this plays out in real life. So this first set of charts, I wanted to show you a very explicit connection between health and social experiences. So here you can see that Black people have the highest rates of hypertension of any racial group. And in this chart, you can see that older Black people experience more daily stressors than any other group. Hypertension is a disease that is exacerbated by stress. And so it would be more likely that Black people would be diagnosed with hypertension because they experience the stressors associated with embodying a stigmatized racial identity and the class and educational inequality disparities that often come along with that. Okay, let's look at another chart. This chart shows us that access to healthcare is greatly improved by having insurance, and it reduces the disparities in health outcomes by race and ethnicity. But we know that everybody doesn't have access to insurance. And in fact, we have a presidential administration that's trying to limit people's access to healthcare. This is problematic for health outcomes across the population because in the United States, health itself is constructed around access to health care. So if you can't get quality health care that covers preventative appointments and specialists and inpatient procedures and visits, then you are more likely to be ill at some point over the course of your life. And because access to healthcare happens along racial lines, illness also then happens, and health happen along racial lines. Okay, let's look at this chart where it shows us that racial minorities here, Black, Hispanic, Native American, Pacific Islander, are have been much more likely in the past year, according to this data, to see a doctor because of cost, which takes us back to the chart that we just looked at. Insurance dictates access to healthcare, and access to healthcare predicts health, specifically because we connect insurance to employment in this country. And we're one of the few countries in the world to do that. That's very problematic when we have for more than 40% of the population un or underemployed, meaning employed in positions sort of underneath what they need to live and subsist, and certainly not providing things like health insurance. And all of this determines how long your life will be. You can see in this chart, white people, the average age of white people in this country is significantly older than any of the other racial groups. And that's because white people are more likely to have the class status and obviously the racial identity to get quality health care in this country for the extent of their lives. And they can extend out the length of their life as a result of that access to healthcare. Okay, I'm going to leave you with our last active learning exercise of the semester, and it's a very simple one. I just want you to think about how you would describe yourself. Are you healthy or are you ill? And why would you describe yourself that way? Come to discussion this week and let us know what you came up with. I'll see you then.